Hi everybody, my name is Cherrial and I'm a part of Jules Inspiring Children Foundation. I'm a postgraduate intern there and I'm going off to Stanford University next fall. The program's really helped me find happiness within myself as I've struggled with suicidal thoughts and depression. So I'm really, really grateful to be here and very grateful for the program that helped save my life. And I'm here with Dr. Blaise Aguirre. And I was wondering, Blaise, if you could just give us like a brief background on who you are and the program that you created and why you felt the topic of suicide was so important, especially right now.
Thank you so much, and it's just wonderful to see you. You inspire more than just children. Let me just tell you, you inspire adults. You inspire so many people, and I appreciate how you're helping us out here and helping the cause. So I'm a child and adolescent psychiatrist, meaning that I, in theory, work with from young children to people in their 18, 19, 20. But most of the people I work with are adolescents between the ages of about 14 and young adults 20 or so. What I was interested was always in long-term mental health of people. I was worried about how we got people into a cycle of, being in hospital, medicating them, then being out of hospital, and that it didn't seem that those techniques were the answer for most people. Sometimes they were. So we wanted to address a group of people, and mostly suicidal people and people who were self-destructive. And rather than either medicating them or hospitalizing them, was to give them new skills, new ideas to manage very difficult moments. And that in order to do that they had to know what they were struggling with. And in order to know what they were struggling with, that the practice of mindfulness would be at the core of the work that we did. So we started a program about 13 years ago. And all we did was accept young people who were very, very suicidal and who were struggling with self-injury, who'd had very difficult lives, and just taught them new ways in a very, very compassionate environment. So that's what I've been doing for the last 13 years.
I got the pleasure of getting to meet you, and I've never met, a doctor or a psychiatrist that has the amount of passion and love for what you do. And I'm curious, where does that passion come from?
Many people have struggled with their parents. I had a wonderful mom, who just loved people. And I could just see how healing that capacity was. And there are people who love what they do, whether it's gardening or whether it's cooking or whether it's playing a sport. And for me, seeing people content, happy with their life, it just brings me so much joy. So I never actually thought of it as a job. Now, of course, it's a job as well. And I have a lot of the job part of my job. But the part that brings me the most joy is just seeing people content and seeing that they can, when they have that moment where they click and they say, wait a second, I'm not defined by what something external to me has defined me by.
And so I'm curious, when you see a patient that is struggling with suicidal thoughts, what are the top 3 skills or tools that you teach them?
Most people struggling with a lot of suicidality are in distress. Okay, so let's just take that point of extreme suffering that leads someone to be suicidal and that they're in distress. So one of the skills that we teach is if somebody's in distress, how do they tolerate that distress? So there's a skill set that we call distress tolerance. And within distress tolerance, there are these skills that we teach, okay, in this moment, what can you do? So for instance, now one of the skills that we teach, for example, is what we call an ice dive. and where you literally submerge your face into ice cold water. Now, there's many things that you might be when you put your face in ice cold water, but it's very hard to be actively thinking about suicide when your face is in ice cold water. So what we want to do is we want to remove the focus of attention from suicide to some other intense stimulus. Now that is based on the science that when people put their face into ice cold water, it activates the dive reflex and it lowers the heart rate, it lowers the level of agitation. Now they might get very upset with me for having told them to put their face in ice cold water, but I can deal with upsetness. I don't want a dead person, right? Okay, so there's how do you manage this immediate moment? The other part of it is also the practice of radical acceptance. So it's sort of this idea that maybe in this moment, things are really awful. But we also know that this moment is as unique as every other moment in the world. And that what will happen is, because life is impermanent, things will change. We know that they're going to change. So that if we can get through this moment, if we can accept this moment purely as it is, most people have gotten through the worst moments in their life in any case. This is just one of those other ones. They can get to a moment where they can, different things can be done. So that's the distress tolerance. Okay. The other part of it is mindfulness practice. So we've talked distress tolerance, mindfulness practice. So for instance, that most people when they're suffering are either spending a lot of time thinking about something terrible that happened or a very bleak future, but they're not very present. So it's sort of teaching them not to spend too much time dwelling in like a horrible future that doesn't exist or a past that no longer exists. That all of these things are happening in the moment right now. So it's sort of how do you focus much more on the present moment? The other thing is that we use emotion regulation skills, so that often people are when they're very suicidal, their emotions are very heightened. So how do you bring your level of emotionality down, and how do you begin to work on that long term so that you don't get caught in a spiral of very high emotions? So, but in the present moment, if somebody were saying right this second, I would do everything in my power to prevent that from happening, obviously, but I would want them to change their body chemistry immediately. So, face in ice cold water, sprinting up and down a little hill, something like that would change their immediate experience.
So true. And I'm also curious in that because you listed just a few different thoughts that, maybe a lot of patients you see have. Do you see like a commonality within do you feel like the narrative is usually pretty much the same within like all of your patients? Because in my life, it's you said the exact narrative that my mind used to come up with. And when I talk to my other friends that have maybe struggled with some of the same things I have, I just see the similarity of wow, that's literally the exact same narrative that my brain came up with. Do you see, I guess, a commonality in those thoughts with your patients?
Yeah, I think that most people who don't want to fight on or who feel like that they need to give up feel that the world would be better off without them, that that no one will miss them if they're gone, that they can't contribute anything to the world in any case. But here's this is why it's so fake, that whole story. And that is, if we tell ourselves something enough times, it's like the Easter Bunny. You tell yourself that the Easter Bunny exists enough time, and after a while you believe in the Easter Bunny, or Santa Claus, or anything that's just not true. And then later on they say, okay, but then society also tells you, yes, it's true, and then it is. So once you start believing that thing that you've repeated in your mind over and over and over again, you start to believe it, and it's just repetition. So I see that many of the people who struggle in this way have that repetitive thought. But then why repeat that thought? Why not repeat another thought like, I am powerful, I am wise, I am significant to the world. Why not repeat that thought? You could say it's just as fake, fine, but let it be fake in that direction. Maybe by repeating it, you also see that it's true. So So I see that there is a lot of commonality in that, and the problem is that it it feels so real that it's even hard to imagine that I'm just going to label that as a thought that will pass, because it just feels like that is the truth, and it's not the truth. I mean, that's the other thing. It's absolutely categorically, it's not the truth.
You mentioned in that, you said that a lot of the people that do come to you they're looking for solutions. They're actually wanting to change. They're not in a, like, they may be getting thoughts that they don't want to live anymore, but they're trying to find a solution to those thoughts. And so I'm curious, like for me, I struggled a lot with my father, who struggled a lot with suicidal thoughts. And I don't know if he ever reached a place where he was fully willing or ready to change. And I spent a lot of, my time and my energy trying to like force change on him or trying to change him myself. And I'm curious what advice you would give to people who maybe have someone in their life that is struggling or considering suicide, and how they can best support them when they're going through that.
It's impossible to force someone to do something that they don't want to do. And sometimes what happens is if somebody's so severely suicidal, they get locked up in a psychiatric hospital, um, which doesn't actually ever solve anything. It might keep them out of harm's way for a few days, but it doesn't actually solve anything. And I think that so first of all, like in an extreme situation, if I had no other ideas, that's probably what I would do. I would say, I need to get this person to safety. But I do everything I can to actually keep people out of hospital. But I'm not going to be a cowboy, in the sense of saying, okay, you can do this. If somebody really feels they cannot, then that's one. But the other thing is this, and that is, and maybe I'm more optimistic because I've seen the vast majority of people who are suicidal get to the other side of suicide. So I I recognize, I validate just how much they are suffering, even if they don't necessarily want help. I but I do two things. One is I try to live my own life in a way that shows kind of best practices in terms of mindfulness and healthy living. But also, I always make the statement that I'm going to be there for you as long as you want my help. And then I also make it very, very clear how devastated I would be without that person. If I would be, and so I'm honest about that. It's never the solution. That there are many solutions for whatever the person is struggling with. Suicide isn't one of them. That I'm completely, I'm completely opposed to it. But that I can recognize that they're suffering. That I will do my best to help them. I'll throw myself fully in if they come to me. So it's so if they're immediately suicidal, then I'm not going to leave them. And then, if I have to call emergency, okay. But if they're chronically, it's like we can continue to work on this together.
Right. That's so powerful. And I think I really resonated with the beginning as well of like, okay, yes, we can do these actionable things to help them, but really the first step is like helping yourself and learning how, to be a light or be an example for that person, to show them, what it looks like to actually work through those thoughts and come out on the other side of them. And so I think that's super, super powerful and something that helped me a lot personally when I was dealing with my dad or other people in my life who were struggling. And that was the best way I found that I could help them, especially if they weren't in a place where they were willing or ready for change. So I also had some questions specifically relating COVID, because I think I'm pretty sure it's like 800% increase in, suicide hotline phone calls. I'm sure just a time of isolation is when you're left with your thoughts. And sometimes those thoughts can get overwhelming. And I think it's been had a pretty big impact on society in general, but I think it's had a huge impact on mental health. And so I'm curious what your thoughts are and your opinion on how COVID-19 has affected depression and anxiety, and specifically suicide in young people and adults.
Yeah, I mean, the numbers are very bleak, unfortunately. The, the biggest study from the Centers for Disease Control, or the CDC, showed that 1 in 4 people between the ages of 18 to 24 were seriously considering taking their life. And we've seen a massive spike in substance use deaths, depression, and anxiety. And I worry that in our understandable attempts to prevent COVID illness and COVID deaths, that we've neglected mental health illness and mental health deaths. And so when we become too focused on the one end of the physical illness at the expense of the mental well-being of people, it does really concern me. And the other thing is that today's depression and today's anxiety is going to continue to have waves into the future. So my hope is that we do more like this, that have more discussions around mental illness, not so much focused on COVID, and then getting people out of the cycle of fear, because we're resilient human beings, and we can get through some very, very difficult moments, but we also ought not to give up on the things that make us happy. So rather than taking antidepressants, we should live an antidepressant life. By doing what? But because there are some things that make us joyful. Earlier on, you and I were talking about like maybe shows on TV that might bring us some joy, or books that we wanted to read, or exercising, or learning how to cook finally, or gardening. So rather than just getting stuck in, I have to isolate, that I can also engage. And the other thing is that, you can still go for walks with friends, and you can take reasonable precautions. But I think that we've given such a draconian message about isolation that we've neglected the impact on mental health. But there are other things that you can do to sort of help yourself. And that's by getting out of bed and go garden, go for a walk, take your dog for a walk, take a neighbor's dog for a walk, stuff like that.
Do you have anything else that you want to share with everyone before, we go off, or any last, pieces of wisdom or advice concerning suicide or depression or anything in general?
Yeah. Never give up. Most of us, once we are gone, will be gone for the billions of years. So this is a time to pay attention right now, to see the possibility in the world, but don't give up. Never give in to suicide. Never give in to suicidal thoughts. You can defeat them. You can defeat suffering. It's hard, but you can do it. And many, many people have done it. And that once you can see that you're more powerful and wiser than you imagine yourself to be, and that there are people that you can connect with, there are other ways. So sending just deep, deep compassion for all the listeners, for you, for the foundation, and for all the work that's being done.
And I'm dittoing that message to everyone that is watching. And I'm also curious if anybody is watching and you want to comment in the chat and just say maybe one insight or principle or thing that you learned from this interview. We would love to hear about it. And I'm sure everyone else would love to know, what you learned from it and what you gained. So feel free to type in the chat. And thank you guys so much for listening in.